All women need to have breast screening for their breast tissue as part of a normal body breast cancer prophylaxis. 1 in 8 Australian women get breast cancer, so it's incredibly important that this is done. In my practice, if you're over 40 and you haven't had a mammogram, then I will ask you to have one before surgery. The normal time to start breast screening, if you're a normal community person without a strong family history of breast cancer, would be around 45 years of age. But I think if you're having breast surgery, then it's well worthwhile having a mammogram if you're over 40. If you've got a strong family history of breast cancer, it may well be worth having a mammogram at any age. Once you've got the breast surgery completed, if there's implants in, then breast screening becomes slightly more tricky, but not really. Your breast doesn't know that there's breast implants in there. The implants sit behind the breast, whether or not they're under or over the pec muscle, they're always behind the breast. So of the breast screening tests that we do, you can examine a breast just as well with implants in as not. It makes no difference to examination. It makes no difference to ultrasound. It makes no difference to MRI scanning or CT. However, the most commonly used test for breast screening is a mammogram, and women with implants can't always have a mammogram. You've got to be able to squash the breast tissue flat in front of the implant to have an effective mammogram. Don't have the breast implant squashed in the mammogram machine, because there's an incidence of damage to the capsule or even the implant if that's done. In the event that you can't have a good mammogram with breast implants in, then simply have an MRI. This used to be a really difficult problem, but it's not now, because the wide availability of relatively inexpensive MRI machines means that we can get a really thorough look at your breast tissue from a screening point of view with an MRI instead of a mammogram if you can't have a mammogram. If you don't have breast implants in and you've had a breast reduction or a lift without implants, then all of your breast screening is essentially normal, but your breast will look strange for a while soon after the surgery because of the internal scarring of the breast. So if you're over 40 without a family history, it's well worthwhile having a pre-op mammogram, and then probably wait 1 to 2 years if all is well before having your next mammogram, and you need to let the radiology people know that you've had a breast reduction or breast surgery and your new baseline will be there. Any breast tissue that's removed during the surgery will be sent for pathology testing anyway. So if you've had a reduction, for example, then there's been pathologic testing to check whether the breast tissue is harmless that's taken out, and that's always reassuring as well. That's breast screening and breast surgery. Pretty simple.